For decades, if you heard the words cancer diagnosis, the treatment path was pretty predictable and honestly very intense: chemotherapy, radiation, and surgery. These treatments saved lives, but they also brought serious side effects, uncertainty, and often a one-size-fits-all approach. But what if I told you that in 2025, that playbook is being rewritten in ways that even doctors couldn't imagine 10 years ago? Stay with me, because what I'm about to share might completely change how you think about cancer treatment today. We're talking about breakthroughs powered by AI, precision medicine, and something that turns your own body into a cancer-fighting machine. These aren't future theories. They're real, happening in clinics right now. But before we get into the details, let me ask you something. If technology could predict your cancer risk years before symptoms, would you want to know? Hold that thought. We'll circle back to the answer in just a moment. Section 1. AI Revolution. Let's start with diagnosis. For decades, the wait for results has been agonizing. Tissue samples, scans, all dependent on human analysis. But in 2025, oncologists have a powerful co-pilot: artificial intelligence. This isn't about replacing doctors, it's about giving them superhuman precision. AI models, trained on millions of images, can now scan CTs and MRIs in seconds, spotting details even the sharpest eyes might miss. It can even predict cancer risk years in advance. Imagine the shift from reacting to cancer to preventing it. Now, back to the question I asked: would you want to know early? Most people say yes, but here's the twist. Catching cancer early doesn't just save lives, it changes the entire treatment strategy. That's where the next big shift comes in, and it's huge. We're about to talk about something that makes chemotherapy look ancient, but before that, there's a surprising detail about AI most people miss. AI isn't just about finding cancer, it's about understanding it. It analyzes your genetic data, tumor profile, and medical history to suggest the most effective treatment with the fewest side effects. It even matches patients to clinical trials in seconds, opportunities that used to take months to find. If you could have a treatment plan 100% tailored to your body, how different do you think recovery would feel? Think about that, because what's coming next makes that a reality. Section 2. Precision medicine. Here's where things get exciting. For decades, chemotherapy was like dropping a bomb, effective but indiscriminate. Precision medicine flips that idea completely. Instead of a one-size-fits-all sledgehammer, we now have tools designed like keys for very specific locks, mutations inside cancer cells. And in 2025, the ability to create those keys has exploded. Take KRAS mutations, once called undruggable. Today, new targeted therapies are unlocking those doors for the first time, giving hope in cancers like pancreatic and colorectal, where options were once limited. And here's a psychological question for you. If you knew a pill existed that only attacked the bad cells and spared the good ones, how would that change your view of treatment? Keep that in mind as we go deeper, because what comes next is even more personal. We've talked about AI and precision medicine, but the next strategy isn't from a lab, it's from inside your own body. Section 3. Immunotherapy 2.0. What if the best cancer fighter isn't a drug but your own immune system? Immunotherapy 2.0 makes that real. Take antibody-drug conjugates, like smart delivery systems. They find cancer cells, attach, and deliver treatment directly inside them, leaving healthy cells mostly untouched. Then there's CAR T-cell therapy, often called a living treatment. Doctors re-engineer your immune cells to recognize and eliminate cancer cells more effectively. This was once only for blood cancers, but now it's making its way into solid tumors, the toughest cases. And here's something even more futuristic: personalized cancer vaccines. Using mRNA tech, doctors can now create vaccines based on your exact tumor profile, teaching your immune system to hunt down any cell carrying those mutations. If your body could remember and fight off cancer cells the same way it remembers a virus, how would that change survival rates? We're starting to see that in trials today. But here's the real takeaway. All these technologies, AI, precision medicine, immunotherapy, are about to converge, and that changes everything. The oncology playbook in 2025 is no longer about one-size-fits-all treatment. It's about personalized, data-driven, and highly targeted care. AI sees patterns we can't. Precision medicine gives us keys instead of sledgehammers. Immunotherapy turns our bodies into cancer-fighting allies. And here's the question I want to leave you with. If these breakthroughs are real and happening now, what does the future of cancer care look like 5 years from today? If this gave you hope or taught you something new, share this video. It might reach someone who needs it. Hit that like button, subscribe, and turn on notifications for more insights on the science shaping our future.